Hi, I'm Claire Harris from Promote Mental Health. We're a business that help people to have a better understanding of their mental health and well-being. During the coronavirus outbreak, we are putting together these video blogs to help people manage their mental health over a really challenging time. So the guidance we have coming through daily is changing at the moment, and it's really important that we consider looking after our minds as well as our bodies. It's understandably a really worrying time, and it's quite natural to feel anxious, worried, and isolated at this time. Often we feel like this when we don't have control over the situation and we do start to worry. But there are things we can do to manage these feelings, and we will go through these top 8 tips that we have today. So the first 2 tips are around managing our exposure to the news and making sure we're using reliable sources of information. Our first blog focused on these in a lot of detail. So it's important that if we're getting stressed by social media and by watching the news and the exposure to the spread of the outbreak, that we minimise our exposure to this, perhaps cutting out notifications and just looking at the news once a day. Also to use reliable sources where we're looking at NHS guidelines or guidelines from Public Health England. For more detailed discussion on this, see our first blog. Our third tip is around communication, and this is going to change massively over the next few months as we are having to do social distancing, isolating, and not going to social gatherings and seeing people. So it's really, really important. We're human beings and we thrive on social interaction and communication. So it's important we find other ways to communicate. So we can make sure we make phone calls to people. We can use WhatsApp, FaceTime, texting people. It's really important that we try to connect in many other ways as we're not able to do that face to face. And also consider about those people locally or neighbours that are vulnerable and maybe on their own, trying to reach out to them in ways that we are allowed to do. Making a phone call or dropping them a note is really helpful. It's important to keep ourselves well physically and emotionally, and eating can have an effect. Eating healthily can have an effect on our mental health and well-being as well as our physical health. So if we're eating a balanced diet with fruit and veg, this can help boost our immune system. And if we're eating things, if we regularly and choose foods that release energy very slowly, this can help us to keep sugar levels balanced and to maintain a balanced mood as well. So it's really important that we're eating well. Exercise, there is a strong evidence base for the mental health benefits of exercise, and it's really important that we still maintain this even though we may be restricted slightly. So if it's possible to still go out and exercise, we're allowed to do that in families, walking, getting out in the garden if you've got one. Inside, we can still maintain our physical activity levels by watching videos or things online, doing physical activity within the home. Also to try and get outside. So it's important that we still get light and that we get fresh air. If we're not able to get into the garden, sitting by the window so we're getting light, making sure we open the windows so we get fresh air. So light and green space, again, have strong mental health benefits. So it's important that we still try to maintain those. Hobbies and learning and having fun. So in order to keep up our morale and keep our well-being good, we need to be doing things that are fun as well. So we have this time at home, possibly thinking about exploring hobbies that we don't have time to do, learning new skills, and also making sure doing things that are fun. So if a lot of us are about to face a period where we're going to have our children at home, we may be having to teach them as well. So making sure that within that we build in some fun. So we can be looking at creative projects, DIY projects for ourselves, bringing the family in, things that we wouldn't normally have time to do, but that everyone enjoys doing at home together. Our last tip is around changing our mindset, and this can be very, very challenging. But rather than thinking about the things we're not able to do, it's thinking about things that we can do. So this is also changing our attitudes and possibly lowering our expectations about what we were planning to do over the next few months. So if we are more realistic about what we can manage, this can help us feel more positive. So accepting that things are going to be different and that things are going to be challenging. So lowering our expectations, acceptance that we're now in a different position to where we were a couple of weeks ago, and kind of starting to move into that level of a different way of behaving and a different way of managing at home. Our next blogs are going to be focusing on managing anxiety and stress, because we think that's really important and that's a big issue for a lot of people at the moment. And we will be doing a blog on how to manage working from home as well. In terms of mental health concerns, if anyone is extremely concerned about themselves or anyone else in terms of mental health, it is really important that you reach out. The Samaritans will listen to you, and their numbers are, I've got them. So the Samaritans number is 1116 123, and people are there 24/7 to listen to anyone in crisis. You can also text SHOUT, which is 85258, and you can text for any crisis situations. And we are very lucky in Cambridgeshire to have the first response team. So if you phone 111 and ask for option 2, you can speak directly to a mental health professional. So in extreme cases where someone is really struggling with their mental health, there is support out there. Thank you very much for listening.